Good afternoon, ladies and gentlemen, and thank you very much for joining this webinar on competing global narratives, COVID-19 and beyond. It is co-organized by the Geneva Center for Security Policy and the MGIMO University in Russia. My name is Alexandra Matthias. I'm heading the Effective Governance Cluster at the GCSP. Our center celebrates this year its 25th anniversary. We are an international non-profit foundation physically based in Geneva, Switzerland. And our foundation council is comprised of 53 states, including all the P5 members of the United Nations Security Council. The mission of our center is to promote peace and international security and to prepare and transform individuals and organizations so they can create a safer world. We are impartial, independent, and inclusive. The center achieves its objectives on the several parallel tracks through executive education, research, and dialogue activities, including public discussions and closed professional meetings, but also we offer innovative fellowship programs for executives in transition. Our goal is to help current and future leaders to be better decision makers and to nurture a global community of leaders who advance peace and security globally. Now I would like to come to the topic of today's webinar, of today's discussion. We are all living through a major global crisis of COVID-19, which has a devastating impact on the public health systems, on international economy and trade, and as well as on the political interactions. The already existing tensions and rivalries in global politics, for example, relationship between Russia and the United States, or Russia and the EU, or the US-China relations, are transformed and even amplified by the COVID-19 crisis. While the world suffers from the virus spread, different countries have adopted diverging narratives on the current situation, which reflect the already existing political cleavages between them. The pandemic downplays the role of the multilateralism in the world and reinvents the importance of the role of the state. We observe less interstate cooperation, while self-isolationism and protectionism are on the rise. The most illustrative cases here again are Russia, China, and the United States and Europe, where the pandemic amplified the pre-existing political tensions and underlined the gaps in the international peace and security. So the objective of this webinar is to analyze how the COVID-19 narratives differ in Russia, China, United States, and Europe, and to discuss if there is a possible hope of finding common ground and revive international cooperation. So to discuss these issues today, we gathered an excellent panel of speakers coming from different countries, and I'm very pleased to introduce them to you in the order of their presentations. So we will start, the first one to speak will be Dr. Yelena Katana, the leading research fellow of the Center for the Post-Soviet Studies at the MGIMO University. She's also the co-organizer of this webinar. Yulia is a specialist of security politics in Eurasia with a focus on regional organizations and Russian approaches to conflict settlement. Then I will give the floor to Ms. Xinyu Yuan, the doctoral fellow at the Graduate Institute of International Development Studies here in Geneva, who will present to us the Chinese perspective. Xinyu is a doctoral researcher of the project Coherence or Contestation, Chinese, Japanese, and Russian approaches to the transformation of peace-building practices, where she has conducted extensive research on Chinese engagement in post-conflict and fragile contexts. The United States narrative will be then discussed by Dr. Daniel Werner, who has served as a deputy to the director for many years, as well as a founder and director of several programs on international organizations at the Graduate Institute in Geneva. He has also lectured and taught internationally with extensive publications as well as commenting in international media. Dr. Werner has served as an advisor to the UNHCR, ILO, and NATO, and has been a consultant to the Ministries of Foreign Affairs and Defense of Switzerland, as well as in private sector. Then we will have Dr. Reinhard Krum, the head of the Regional Office for Cooperation and Peace in Europe of the Friedrich Ebert Foundation, who is joining us today from Vienna. He will speak on the EU in times of Corona, how to combine internal recovery with international responsibility. Dr. Krum is also a lecturer on Russia and Eastern European history at Regensburg University and holds an honorary professorship from the Department of Political Science at Moscow State University. He also comments frequently on current political events in the international media. And last but not least, we have asked our Swiss colleagues from the Swiss Federal Office of Public Health to provide a detailed overview of measures taken by Switzerland during this crisis. And we're very pleased to have with us today Mr. Patrick Matthias, who is the head of the section of Crisis Management and International Cooperation at the Swiss Federal Office of Public Health. Few more remarks, technical remarks. Each speaker today will have 10 minutes for his or her presentation, and we will be strict to keep up with time. After the presentations, we will take your questions, and we plan to finish this webinar about 3:30 Geneva time. As we have very large audience today, I can see we have more than 120 participants registered, and already I can see 64 participants who joined us. We ask you to write your questions in the chat box. You will not have an opportunity to ask them orally. And my colleague, Mr. Miro Guzzini, will address them to the speakers. So please don't forget to mention to whom you address, to which speaker you address your question. I would also like to attract your attention to the fact that this is a public event and it will be recorded. The recording will go until the Q&A session, and then we will stop it. And the link to this webinar will be afterwards available on ours. So on this, I close my opening remarks, and without further ado, I would like to give the floor to our first speaker. Julia, please, the floor is yours.
Thank you, Alexandra. Good afternoon, dear participants. Well, I represent here MGIMO University, Moscow. MGIMO University is under the Ministry of Foreign Affairs of the Russian Federation, and I work at the Center for the Post-Soviet Studies, one of the research centers at the Institute for International Studies at MGIMO, and we provide policy recommendations for the Russian Ministry of Foreign Affairs, and we have a program of international cooperation in this group of research centers, Institute for International Studies. And I would like to thank the GCSP for organizing that very interesting debate that's very important to attract different audiences and speak about this crisis from different perspectives. So now I'd like to start my presentation. Just a second, I will start sharing that. Okay. Great. I will be talking about the Russian narratives and what matters for Russia more, its status of a global power or probably state capacity. I will try to look into it. You might have heard about different Western views on Russian approaches to dealing with the coronavirus, and generally the Western reactions are that what is Russia doing now is mostly about propaganda. For example, there were two very prominent cases when Russian authorities sent some equipment to Italy and to the United States, and the reaction of the Italian authorities and Italian media was that 80%, as you see the quotation of the Russian equipment, was useless, or in case of the provisions to the United States, that actually all those ventilators in the equipment were dangerous for use, and that's why actually this assistance also was useless. So those were the major titles in the Western media. And what's more, actually Western media questioned credibility of Russian official sources on the number of deaths of people who died from the coronavirus. Here you can see the titles from different media outlets, mostly from the New York Times, and the Russian Ministry of Foreign Affairs had to react to some publications by the New York Times, and actually New York Times had to change the title of one of its publications 3 times in order to make it more neutral. And what's more, you see that some of the media write about generally political situation in Russia, that Putin's approval ratings slide, and so on. So those are the major topics that attract the attention of Western media and Western audiences. In Russia, we have a very interesting phenomenon which occurred mostly in April. There are the so-called virtual protests, which occurred in several large cities and towns in Russia. So you see a picture on your left. So that's the picture from the car navigation system where people can leave some comments. So they might not be physically there on a street, but they leave comments with some slogans, mostly about the emergency state, that they urge the Russian government to introduce the state of emergency. But I would say that the majority of people write some comments of a humoristic character, and that's why I would compare this phenomenon of virtual protests to an earlier phenomenon in Russia, which are called monstrations. For example, from 2018, you can see the picture from Gazeta.ru that the life is generally absurd. And what I suggest that we do today, I think it's possible to discuss the COVID-19 crisis using some conceptual narratives. In 2013, Francis Fukuyama, who is known for his idea of the end of history, published an article, "What is Governance?" In Russia and generally in the IR community, we somehow missed this debate because in Russia we mostly concentrated on the crisis around Ukraine, Crimea and Donbass, and didn't speak that much about governance, accountability, and so on. What was interesting in this idea by Francis Fukuyama is that in addition to democratic accountability and rule of law, we should also talk about state capacity. We should measure that. Administrative capacity, like the delivery of services, the quality of services, education, healthcare, and so on. And I think that now it's very timely that we discuss the state capacity. And now I suggest a conceptual approach. What is questioned generally in those debates around the COVID-19 crisis? When Western media publish something about Russia, generally they question the democratic accountability parameter and specifically the accuracy of death data. And Russian officials have to refute that and respond to that. And also Western media question the status of Russia as a global power. They ask whether the goals of humanitarian assistance are really humanitarian or they're mostly geopolitical and propagandist. In Russia, we have a different approach. If we analyze the reactions of the general audiences in the social media, in publications, in the media outlets, generally the public questions the rule of law, and first of all, the legality of fines for breaking the self-isolation regime, because those fines are now introduced for those who don't stay at home and who don't register with their mobile phones in this virtual system created for checking whether people stay at home. And there are a lot of technical mistakes, and that's why people, of course, are not happy about that, and they start protesting. The second dimension of this questioning of the rule of law in Russia is about the state of emergency, because that's a legal concept. If the state introduces the state of emergency, then it's important for small and medium businesses and generally for businesses in terms of their contracts and so on. And I would say that most of the publications and narratives in Russia are currently related to the question of state capacity. A very much discussed question was the system of digital passes introduced in Moscow. And on the first day of introduction of those digital passes, there were very large queues outside the metro stations on the first day because this system didn't function properly. Then there was a question of payments to the medical workers. Vladimir Putin on one day said that every medical worker in Russia has to receive additional payments. And several days later, it turned out the local authorities and the heads of the hospitals do not know how to properly distribute the money, and actually medical workers do not get the full payments. And it became very known and discussed, and that's a hot topic these days in Russia. Also, the topic of payments to the families with children under 17, and also people rushed to the web portal of state services, gosuslugi.ru, and it didn't work for a couple of days because all the people around Russia start they tried to write a request for such a payment. And finally, what I suggest to discuss, that's my last slide, I think that our debates about the COVID-19 should not be so much around the type of political regime, because it seems to me that these days a lot of comments in the media are about whether democratic regimes react better to the COVID-19 or authoritarian regimes. I think we should talk more about state capacity and political culture. By political culture, I mean responsibility of citizens. And I suggest that we look at different models, and our panelists will present different national models. So what I mean, for example, that in case of Sweden, the authorities decided that the population, the citizens are responsible enough to avoid centralized restrictions.
Sorry, that's your last minute.
Yes, I know, I have my timer here. And in Russia, for example, well, I would say that here in Russia, we're not that responsible. We don't always wear masks and so on. The situation in other countries is also different. So that's why I think we should reframe our debates a little bit in the fields of state capacity and political culture rather than type of political regime. Thank you very much. I'll stop here.
Thank you very much, Yulia, for this very interesting presentation, for providing the overview on the Russian narrative, and particularly what was interesting is to show what points in the whole narrative are relevant for the Russian audience or for the foreign audience. You also provided the Western narrative on Russian actions and suggested this conceptual approach to the COVID crisis. It was really appreciated. Thank you, Yulia. Now, without further ado, I would like to go to the next speaker, Ms. Xinyu Yuan. Xinyu, the mic is yours.
Experience is a bit special because when COVID-19 severely hit China in January, I was there. I returned to Europe 2 days after the US announced a travel ban against the Chinese. There was no infection in Switzerland at that time, but it quickly evolved into one of the worst affected countries. So I experienced the outbreak of the coronavirus in China and in Europe. And this gives me an opportunity to scrutinize the Chinese narratives from both an insider perspective and an outsider perspective. Today, we are talking about the competing narratives. It's easily forgotten that things did not start that way. I got 2 lists from my sister, who happens to have studied Chinese media coverage on COVID-19 for her dissertation. And sorry, I couldn't move on.
Let's try. One moment, please.
Double-click your screen a few times.
Yeah, I couldn't move on to the next slide. Or maybe I will just continue.
Maybe try to close it and open it again.
Oh, I couldn't open as well. Okay, maybe I will continue without the slides.
Yes, please do, if it's fine with you.
So I got 2 lists from my sister, and this list shows the topics between January and March covered by Caixin, a market-oriented media group in China that first investigated the outbreak in China. Basically, the news during January and February was overwhelmingly about scientific data and updates on statistics and administrative measures, and to a lesser extent, checking the source of virus and the responsibility of the local government. Same for People's Daily, the official newspaper of Chinese Communist Party. So there are very few news about that talking about other countries, but it's basically about the international support China has received from the international community, like from Germany, Japan, UK, WHO, and so on and so forth. So before March, actually, the Chinese narrative was totally about international support and scientific cooperation. For instance, on February 10, Chinese Foreign Ministry says China would welcome help from all foreign experts, including those from the US. And Chinese scientists also quickly released the first electron microscope picture of the virus and the strain information. These measures were largely well received at that time. Some observers contrast the COVID-19 with the outbreak of SARS in 2003, noting that there has been considerable progress for China in terms of transparency and cooperation, including US President Trump. During the early days of the outbreak in China, Trump appraised Chinese efforts in containing the virus and said numerous times that the US and China were working closely and trusted each other. Similar positive comments were repeated through January and February. So at that time, I would argue there were no signs of a blame game or a first battle of narratives as we observe now. But this amicable vibe shifted in early March. On around March 6, calls emerged in the US, UK, and Australia to hold Chinese government accountable for initial mishandling of the outbreak of the virus, which quickly became a primary concern of the Chinese government. And that's when we started to see this bitter war of words. Since then, China has been pushing back criticism it received. I'm not going to address the details and the tit-for-tat tactics between China and the US, but I found it very interesting how China's narrative unfolded and evolved. So I want to share 3 points here. Firstly, China mainly resorted to Twitter, a platform banned in China, to present its narrative. The Hamilton 2.0 dashboard, a project of the Alliance for Securing Democracy at the German Marshall Fund for the US, tracked the Twitter accounts associated with Chinese government and found that by May 20, the number of China's diplomatic Twitter accounts has tripled to 135, up from just 40 accounts this time last year. And since the start of April, there have been 90,000 tweets from 200 diplomatic and state-run media accounts. Many of these tweets addressed the allegation of information cover-up and shed light on China's performance in combating the coronavirus at home. Many tweets are in English or Mandarin, but the diplomatic accounts are often in the language of the ambassador's host country. So it means that China is building up its skills and channels for better communication with international audience. Meanwhile, my observation is that Chinese narrative was dominated by positive reaction to Western narratives, rather than proactively developing its own account of Chinese experience. This led Zheng Yongnian, a Chinese political scientist at National University of Singapore, to conclude, I quote here, a missing Chinese narrative in the global battle of narratives. I agree that China was caught in a dilemma of reacting to Western narratives. For instance, on April 5, Chinese Foreign Ministry publishes a document in both Chinese and English entitled Timeline of China Releasing Information on COVID-19 and Advancing International Cooperation on Epidemic Response. In this 37 pages long document, China put extreme emphasis on its timely and consistent communication with the US and with the WHO. For instance, it states that as early as on January 3, China began to brief the US regularly at a time when most Chinese actually were not aware of the situation, including me. Also, on May 9, China's Ministry of Foreign Affairs published an article on COVID-19 in Chinese, rebutting 24 lies from the US regarding COVID-19, mostly on the naming issues, the origin of the virus, and China's early measures. Like I said earlier, all those moves were designed to refute the accusatory claims that are floating in some international media, rather than to construct an appealing narrative of Chinese experience. Moreover, I observed that at the most time, China actually reacted with reservations to allow for a flexible shift of narrative and a room for compromise, although occasionally its reactions were pretty aggressive. The tweet of Chinese Foreign Ministry spokesman Zhao Lijun has been widely circulated in international media, in which he said that it might be the US military who brought the epidemic to Wuhan, and shared articles from a suspicious website suggesting that the coronavirus originated in the US rather than in China. However, I noticed that Zhao made this comment only on Twitter, and then he disappeared from this heated debate for a few days. My interpretation is that the Chinese government does not want this dispute to tap into its domestic politics, which would otherwise become out of control. Actually, the official responses from the Chinese foreign affairs system in the subsequent days deliberately downplayed the dispute over the origin of the virus and avoided politicization of the issue. For instance, in an interview with HBO, Cui Tiankai, Chinese ambassador to the US, noticeably distanced himself from Zhao's statement, saying that he stands by his belief that it's crazy to spread rumors about the US origin of the coronavirus. Also, Hua Chunying, a senior official of the Chinese Ministry of Foreign Affairs, avoided commenting on Zhao's statement for several times, and instead urged scientific investigation for the origin of the coronavirus, saying it's an issue to be answered by scientists rather than by politicians. I think all this actually provided a window of opportunity to ease the tension between the two sides and downplay competing narratives. But unfortunately, it didn't work out well. Recently, China has been consciously developing a narrative of its impressive performance and contribution to the global battle against COVID-19, rather than merely responding to Western criticism. One focal point of such a new narrative is the institutional advantages of the Chinese political model that has been able to contain the epidemic and resume economic activity at home in the very short time. The other theme is Chinese.
Xinyu, sorry for interrupting to the last minute. Yeah.
Okay. Yeah. So the other theme of the current narrative of China is Chinese contribution to the global fight against COVID-19, in which China presents itself as a supporter and agent of globalization and international cooperation. I think I will stop here. It's a regret that I couldn't present you all the slides. Thank you, Alexandra.
Thank you very much, Xinyu. That's sometimes the price to pay of the online meetings. We have a luxury of having you all coming from different places, but unfortunately, we apologize, the technical issues can raise. So thank you very much for this contribution. It was particularly interesting for me when you underlined this difference in Chinese narrative before March 2020 and after March 2020, but also the foreign rhetoric about China that moved from international support to criticism. And I also noted the different channels of communication that China used also in different languages to pass its message, to reply to these blaming claims from some countries, but also the idea to avoid the politicization of this issue. Now I would like to turn to Dr. Daniel Werner for his perspective on the US narrative. Daniel, the floor is yours.
Thank you very much, Alexandra, and welcome everyone. I thank the GCSP and MGIMO for organizing this. Obviously, the situation in the United States is enormously volatile, and probably most of you follow the news since the United States has been very transparent about certain things. My major point is that the most important fact to remember is that there will be an election in the United States in November, 5 months from now. So the major concern is domestically. So I will begin by making 5 points about the COVID-19 narrative in terms of that election. First point, will the election happen? I say this because historically there's always been an election in the United States, but there are going to be arguments about how people will vote. Given COVID-19, it will be difficult for people to vote directly. And President Trump has raised issues, legal issues, about whether people can vote by mail. So the question of the election will come up more and more as we approach November. Second point, the COVID-19 raised certain cultural issues which remind me, with my gray hair, of the 1960s. In other words, President Trump refused to wear a mask. We saw that in the factory. There was the issue of social distancing, and he said liberate in certain states. So we're going back to a certain tendency on the part of President Trump to play to his base through the COVID virus. And therefore, there was considerably different opinions about how to react. Economically, the third point deals with the reopening. And I should point out strongly that the United States is a federal system, much like Switzerland, which means that each governor and each state had certain rights to do certain things. And therefore, we had arguments between President Trump, who thought he was in charge of everything, and various governors who said, no, we want to do it this way. So you have the governor of the state of New York, Andrew Cuomo, saying things that were different than the president and other governors. This other economic points would be the notion of where the money that they just said is going out and how it's going to be spent. Again, the problem between the federal government and the states. There are 30 million people in the United States who are now unemployed. There were 44 million people who had no insurance. So how the government is going to solve these problems remains to be seen, as well as, of course, the issue of debt. My fourth point, and those who watch the news and read the papers, deals with race. We know that disproportionately, Blacks and Latinos were more susceptible to having the virus than other groups. And part of the anger and frustration we see in Minneapolis, New York, and other places deals with unemployment, it deals with the public health system, and it also deals with the fact of violence, etc. These are things that we've seen before. Whether this will be a change or not, and whether the fact that there are racial riots going on now, how that will affect the opening and the pandemic, because those people demonstrating in the streets, not all of them are wearing masks. And we will see how all of a sudden the race issue becomes more important perhaps than the issue of the virus, as most people seem to think it's over. And my final domestic point is, as far as the American narrative, that it was and is a demonstration of the failure of the American public health system. And I think as a symbol of the American dream, more and more people are going to wonder that a country can't take care of the people in old age homes and can't solve these kinds of problems. People have unemployment, they don't have masks, they don't have ventilators. This is not the crowning achievement that Mr. Trump was selling, and the United States, as we all know, had more deaths from the virus than any other country. So I begin with the fact that the United States is obsessed with and will continue to be obsessed with the election and certain domestic problems. How does this play in foreign policy? The first thing is quickly that we have to find someone to blame. It can't be an American fault. So it becomes the China virus. Those of us who studied Russia, Soviet Union, we've been there, heard this before. And the question on the politicians and the media's lips, Mr. Werner, is this another Cold War? I say no, simply because there's nothing involved here in ideology. And as we know, the Chinese have more American dollars than I do. So it's not the same thing as the Cold War. But blaming someone else is something that's very simple. And it is part of the America First dialogue that Trump has started, and is, as someone before mentioned, this notion against multilateralism. Living in Geneva, we know that they're now out of the World Health Organization, the World Trade Organization is blocked, out of UNESCO, Human Rights Council is gone, UNRWA no longer part of, Iran nuclear deal, Paris climate, we can go on, Russia certain treaties as well. So the COVID now becomes an American problem. And although it's a pandemic that one would think would have an international solution, it becomes an American problem and for the United States to solve. And the fact that it is withdrawing or suspending or no longer paying the World Health Organization shows that the United States under the Trump administration thinks that it can solve the problems. Now, what are the implications of that in terms of COVID-19, in terms of the world? There is a vacuum of leadership. And one of my major conclusions is that the United States has been the moving force behind the post-Second World War order. And following from Woodrow Wilson, the League of Nations, if the United States is no longer willing or able to lead that order, when a pandemic or a global crisis comes up, there is a lack of leadership or consensus. And the fact that the Security Council is blocked, the fact that the international organizations are blocked because China, Russia, the United States, and the European Union can't agree, will mean that there is going to be less international cooperation. So my conclusions are threefold. The first is, does the world need international leadership? And all of us here are speaking about states. No one talked about Bill Gates or Mark Zuckerberg or Jeff Bezos. And we know that Gates, for example, has made a huge contribution to world health. And are we realizing that if the WHO is limited, if governments will not cooperate, perhaps we'll see more and more in civil society as well as the private sector? Second conclusion would be that the United States, at least for the next 5 months, is going to be obsessed with the upcoming election. So everything, whether it's a health issue, climate change, is going to be presented in terms of politics. What did Trump say? What did Biden say? What did this one say? And that means that there is a vacuum of cooperation. Perhaps Australia, Canada, Holland, New Zealand, certain countries will get together to try and do things, but top down, there is a blockage in the Security Council and there is a general blockage. So the question you want to ask me is it going to change if someone else is elected in November? I make no predictions about elections. I was so wrong the last time, as everyone reminds me, that I refuse to say who's going to win. The point is, can the United States rebound if Mr. Biden wins to be another, the global leader? And my point is, I would doubt it, because I don't think countries now have the same kind of power they had before. And one of the things that COVID-19 showed us is the role of the private sector, the role of civil society, these networks becoming stronger and stronger. And if there is a vacuum of leadership coming from the United States, I'm not sure that either Russia or China or any other country wants to take over the global leadership, because there are prices to be paid, and maybe in our complex, interdependent world, no one country or no state can have that kind of leadership ever again, as we saw after the Second World War. Thank you very much.
Thank you very much, Daniel, for your very interesting presentation. You've raised many questions that I think we can also address a little bit later in our discussion, in the Q&A session. You had a very challenging task today, given all what is happening now in the United States, and you managed to cover it in less than 10 minutes. You underlined the importance of the upcoming elections in the United States in November and the major concern linked to the domestic policy. You covered the public health, economic, political, and even racial implications linked to the pandemic. Then you turned to the consequences on the US foreign policy, including its withdrawal from the WHO, the decline of the multilateralism, and the lack of the US leadership and international cooperation. Thank you for that. And now our next speaker will be Dr. Reinhard Krum with his presentation entitled "The EU in Times of Corona: How to Combine International Recovery with International Responsibility." Reinhard, the floor is yours.
Thank you very much, Alexandra. Also, thank you very much for the invitation from GCSP MGIMO. Hi, Julia. Very nice seeing you. 25 years is fantastic. It's a quarter of the century, and congratulations on that too. And to all participants who are here, I'm not repeating the usual phrase, this is very timely. It's always very timely, otherwise you wouldn't have done it. So I have 2 points, each 5 minutes. Hopefully I'll start my timer here. Internal recovery for the EU and international responsibility. So I'm the only one, I think, who's talking about a union, not about a country. I think the EU, during the time of Corona, felt fairly weak. Not each country, but in general, because it is a test for the EU, and the EU was not in great shape even before. Brexit is still going on, even though the United Kingdom has decided to leave, but the talks are still going on. So in a state of weakness, to have a test like Corona is incredibly difficult, as you can imagine. In general, I would say, and this is more a point from a German living in Austria, in general, at the beginning, there was high support for all the measures and very few discussions. But the minute it eased up, the debate started. Very much towards what Julia said, it's about state capacity. What do states do? And what's the culture in each state? The result, interesting enough, in the EU was that the usual suspect coalitions don't work anymore. It is not clearly south-north. If you have the south, you would include France, and France is in this crisis not really part of the south. It's Spain, Italy, Greece, but kind of very different in its way. You have a new coalition, the so-called fragile north, including Austria, which is not really in the north, but anyway, it's good for the name, Austria, Denmark, Netherlands, and Sweden, who are not willing, at least that's for the moment, and I think there will be discussions, to support this huge effort by the EU. I think the numbers are at 750 billion euros, has never been done before. And those four are very, very worried why they should do that. Usually in this group, you have the Visegrad countries, the Baltic countries, very fragile, but in this case, they're on a different boat because they feel they need the money. They have gone through this in 2008 during the first crisis, and they surely don't want to do this again. So they would be happy to kind of being part of getting money. If I talk about the South, let's not forget Italy is paying into the EU. So it's a country which pays into, but now says, okay, but we also have to get something out. So you have interests across these former groups of North, South, or East, West, which are new, because the countries and the governments have understood that the EU is on the line. This is not something the EU will solve easily. As a matter of fact, we don't know if the EU will solve this. The Brexit is still in the bones of the EU. That was a very, very hard decision for us, for the EU. And if the EU is not recovering economically, the EU might not be as it is today. And I'm not an alarmist. I'm not saying it's breaking completely apart. What I'm saying is that so far the EU, at least until, I don't know, 2007-8, was very successful. And from then on, we have more and more challenges. And this one is the biggest we've ever had. And therefore, the initiative by France, especially, but Germany supported it, of shelling out this money, means something new. It means that not national governments and budgets are driving the EU, because this is what it is right now. But if the EU is trying to get money on the international markets for these bonds, that means the EU is in the driver's seat of money. It has never been before this way. I mean, they're spending money, clearly we know that, but getting money usually only comes through the national budgets, and this is more. This is bigger. And this might mean that the EU is on its way, some countries would like that, to be more a political player. This is the result, I would say, from Corona, and we don't know where this is finally going, but this would have been absolutely impossible before Corona. So it is a catalyst for something within the EU to change. And I would like to follow my American colleague. Having said this is domestically, meaning domestically EU. And what does that mean for the international EU? The stakes are high. Mrs. von der Leyen has said that the EU must be more geopolitical. And Mr. Borrell, the High Rep on Foreign Affairs, has said the EU needs an appetite for power. Before the Corona crisis, this was meant to be addressed at Russia, but not only. You could argue that the EU is in between the United States, Russia, and China. And all my predecessors, all the speakers before have not mentioned the EU really, because it seems not to matter. which I, as a European, would like to differ, of course. But the problem is, how do you be responsible internationally if you're internally even more under threat by not only Corona, but how to fight the results of all that? And there the EU is in a very difficult spot. In general, I would say we're not only wondering what is happening in the US, even though I completely understand it's domestically, but even though it is domestically, there is an administration which is undermining any multinational approach. Again, it's election time, I understand, but I don't think this is helpful at all, needless to say, of course. Second, Julia, apologies for this word, we see a frustrated Russia, which is also internally engaged at the moment. It doesn't go that well for the administration. And we would like to see more engagement with Russia or from Russia, but it's not happening at the moment for known reasons. And then there is an unknown for us still, I would say, China. Germany will take over the EU presidency, as we all know, and China will be one of the main issues Germany will address. We don't take the approach, in general at the EU, I would say, from the US, blaming China on everything. But we, of course, see that China is challenging certain things. And so the EU, as I said, is in between these three big major countries, the US, China, and Russia. And this has never been the case before. Usually we were not in between because we're the closest ally in general of the US. But this is under threat, I would say, and I'm not really thinking that it will change dramatically under a new democratic president. It will get better just because person-wise, but the policy of the US, I wonder if Europe ever plays a role as it has been played before. So I will finish by 3 points. The narrative of the EU is, even though, Daniel, if I may, you said less cooperation will be the case, probably that's true, but the EU will still thrive for more cooperation. You have the initiative of a couple of countries, including Canada, the coalition of multilateralists. At least this is addressing a challenge we have. It's the disarmament issue. Open skies is going down the drain. If the third START will still stay, we don't know. In general, we have very little left, even though we have still enough nuclear firepower around the world. This is very worrisome. Nothing new. I mean, you all know this. I'm just pointing this out. The second point is for the EU to manage globalization. Globalization has been an engine, not only for decades, but for centuries. And to have I think a Russian colleague of you, Julia, said this, Kotunov, globalization with a human face. This is something we are looking for. And this is difficult within the EU and even more difficult internationally. And the last one is, and then you also have mentioned that, the support of multilateral organizations. The UN has its problems, no doubt. I'm repeating the known. Same goes for the WHO. Here in Vienna, we have the OSCE. And it's very easy to criticize these three organizations, apologies. But this very much depends on the nation. So, and I finish here because my 10 minutes are up. The narrative of the EU is to bring its house in order, and this is huge. And secondly, only then, or parallel of course, we will try to make sure in our limited capacity that international cooperation is still going on and will continue. And the final word is, because this is not a second Cold War, this is something completely different. This is something which new threats with new challenges, and not only outside or against a party which challenges our understanding, but it is more, it is bigger than that, because the threats we have is coming down on all of us, which is climate and others, migration, hygiene, what we see right now. So the EU is kind of doing the impossible thing, addressing internal challenges and trying also to be active outside. And I would say time will tell us if the EU is capable of this. It very much depends on single countries. Thank you very much.
Thank you very much, Reinhard, for this very comprehensive presentation. That's true that you had to cover the policy of the whole union, and I think you did it great. It was very interesting to hear from you. You said that the corona spread was a test for the EU in the time of its weakness, and that the usual coalitions don't work anymore in the time of crisis. That the economic recovery of the EU is decisive for its own future, for the future of the organization itself, and that the EU is brought itself in the driving seat now in terms of funds provision, and therefore the implication of the COVID-19 is making out of the EU a more political player, which places it in between the three global powers, the US, Russia, and China. And I'm very happy that we had your presentation here together with the other speakers, and that it is really very relevant to have all these representatives, represent different narratives here of the global actors. You also gave us a hope that the EU will thrive for more cooperation, multilateralism, and globalization with human face, as you put it, to overcome the existing and future threats. Thank you very much for that. So on this, we will move from, I would say, first chapter of our presentations with different countries and with the analysis of the narratives by our experts. And now I would like us to talk more about the case of Switzerland, where we are based, the country which was at some point the most affected by the coronavirus in terms of number of cases per population. Switzerland managed this crisis with success. The recent results show that we only have 19 new cases registered in the last 24 hours. And here I would like to hear from Mr. Matthias, who represents the Swiss Federal Office of Public Health, about the measures taken by his country in this situation. Mr. Matthias, the mic is yours.
Thank you, and I'm hoping that after these four very interesting narratives, my short overview of about the situation in Switzerland is not too boring for you. Anyhow, I try to start my presentation. Do you see the presentation?
Yes, we can see it.
Okay. As you already said, and I tried to situate a little bit the situation in Switzerland. Actually, we have got about 6.5 million cases worldwide, nearly 400,000 deaths already, and more than 200 countries and regions are affected by COVID. In Switzerland, we tested about 30,000 people positive for COVID-19, and we have to report a little bit more than 1,600 death people. As you already said, if you're looking at the incidence, Switzerland is one of the most hit countries in the world. Just to have an idea, and I'm quite sure you know that Switzerland is a federal country, a highly federal country, and therefore the healthcare system is dealt by the respective offices on a federal and on a cantonal level, but it's run by means on a cantonal, communal, and private level, which means that in a normal situation, the national level is more for coordination and not really in the field of the operation. Crises are therefore also dealt on a national, cantonal, and regional level. There is usually no centralized national crisis center, and public protection is a completed action compound coordinated by staffs on all three levels. And the picture you see is just in German, therefore it's, as you can expect, the police, firefighters, the health system, technical support, and finally civil protection under the umbrella of the public protection. In the field of public health, we have a quite new legislation. The Epidemic Act states from 2016, and therefore we have already included the experiences with SARS, with bird flu, with pandemic influenza, and I have to say that this experience, which is included in the law, really helped us to fight, to combat the current situation in Switzerland. Concerning the crisis organization, the federal government's highest priority was and still is the protection of the public, or the protection of public health. To limit the number of severe cases and to prevent an overloading of the healthcare system. And I think with these goals and with these targets, we reached a quite high level of protection. COVID-19 is not only a crisis in the field of the public health, it's multifaceted and has an impact, of course, on all areas of public and private life. Accordingly to that, the Swiss government established a number of dedicated units to support the decision making, and we had a ad hoc crisis management board on the level of the government. We have a quite strong task force of the Federal Office of Public Health dealing with all issues concerning the protection of public health. We have the Federal Civil Protection and Crisis Management Board, who is dealing with all other aspects of this crisis. And finally, we have a Swiss National Science Task Force, who is supporting the decision making on the national level. What have we done? We started end of February with the first measures, and the Federal Council declares a particular situation based on the Epidemic Act, which means that the cantons are not anymore responsible for all decisions taken in the field of public health, but that some of the responsibilities were passed to the national level. Based on this, the first decision was to ban all large-scale events involving more than 1,000 people. Shortly after, 1 week later, the focus on the protection of particularly vulnerable groups started, and we recommended these groups really to stay at home and not to leave home unless it was really necessary. We sensitized about hygiene measures and social distancing. We started a huge campaign with the simple messages concerning social distancing and particularly wash your hands and stay apart. On 3rd 13th of March, 1 week later, we ban all events with more than 100 people and closed all schools. There was temporary entry restriction for persons coming from Italy. As you remember, in the north of Italy, the epidemic was on a high level, and there was some fear to import the cases from northern Italy to South Switzerland, to the canton of Tessin. Again, a little bit later, the Federal Council declares an extraordinary situation in Switzerland, and with this, the possibilities of the cantons to decide was quite limited. I have to say that an extraordinary situation in Switzerland, where the Federal Council really leads the country without the parliament, without the cantons, is very, very rare. Last time an extraordinary situation was declared in Switzerland was during the Second World War. Therefore, it was extremely special for the inhabitants in Switzerland to see such a decision, but it was, and I'm absolutely sure it was necessary to take the appropriate measures in Switzerland, to take it quickly and to take it in a harmonized way over all 26 cantons. After this, the ban of public gatherings was even harder, with max 5 people to meet allowed. We closed all shops, restaurants and leisure facilities, and only establishments providing basic necessities were open anymore. The rest was closed. It was some sort of a lockdown. If I say we closed all shops, restaurants and leisure facilities, still 70% of the Swiss economic was still working. So it was not really a lockdown. It was at least a partial lockdown. In the middle of March, border controls with Italy, Germany, Austria and France were taken in place. It means that the borders to the neighboring countries were closed. And finally, also mid of March, the deployment of the armed forces to assist the cantons and hospitals with logistic and security. Also, the deployment of armed forces in Switzerland is quite seldom and rare, and therefore, just the decision to send armed forces in the cantons to support them to fight, to combat COVID-19 was a strong sign to Swiss people. Finally, 20th March, in order to prevent hospitals from being overwhelmed with serious cases, we decided to ban all non-urgent medical procedures in hospitals. And with this decision, we were able to liberate many beds in the hospitals. And I think this was also the reason why, although we had quite a lot of serious cases, there were no limits or shortages in intensive care units. And finally, the measures introduced to combat the coronavirus epidemic are being followed well. I think at the time being, the situation is a little bit changing. The behavior of the Swiss people is really changing, but hence the Federal Council started to ease gradually the measures in place, starting of the 27th of April. The criteria to ease the measures were that the current and expected development of infections are good, that hospital admissions and the capacity of the healthcare system is in place, and the key elements include and we think we are able to do so, the early detection of new infections through appropriate testing strategies. We have quite comprehensive contact tracing in place, and a consistent isolation of infected person and quarantine of exposed person is absolutely needed to ease the taken measures.
Mr. Matthias, you are on your last minute, please.
Yeah, I'm on the last slide. Exit strategy, phase 1, as I said, end of April, we started to ease the measures. Hospitals were able to resume all medical procedures. And most interesting, hairdressing salons, which are really, really needed, obviously, in Switzerland. Do-it-yourself stores and garden centers were reopened in the first place. Mid-May, compulsory schools started again and all shops reopened. And on 6th of June, which is tomorrow, yes, given the positive developments regarding the situation, the Federal Council decides the measure to put in place to fight the new coronavirus will be extensively eased. I can't tell you all the details about this because the Federal Council will communicate about this tomorrow. And finally, testing and tracing app is for us one of the key elements to really further ease the measures taken. And we increase the testing capacities extensively, and we will also include serological testing in the current testing strategy. And we are currently testing the Swiss COVID app, and we hope to have in place the Swiss COVID app as one of the first countries in Europe middle of June, and we hope with this to keep our level of new infection on a very low level, and hopefully we can prevent the second wave with the measures taken so far. With this, social distancing is still one of the most needed measures to have the epidemic level, the epidemic on a low level. And this information and much more you can find in German, English, German, French, Italian, and partly also in English on our website. If you're interested in more in-depth information, please go and have a look on the websites. And with this, thank you, and hope you all stay safe. Thank you.
Thank you very much, Mr. Matthias. Very detailed presentation. You informed us very well. I live in Switzerland, so I felt I was always very well informed during this crisis. And this, I think, is one of the key issues also for the population to stay calm and to follow the recommendations of the government. I think that your presentation clearly reflected that the measures were taken reflect the Swiss political system, the federalism, and here I think that the conceptual framework which was suggested by Julia in the first presentation was very illustrative when basically when the state capacity was combined with the political culture of the population in Switzerland who followed the recommendations very thoroughly, which brought to the success with the fighting the coronavirus spread. So now I would like to remind once again to our participants to ask questions in the chat box. And please don't forget to write to whom you're addressing your questions. And before we go to the Q&A session, I would like to give a floor for a very short 3-minute presentation to Dr. Kazushige Kobayashi, who is postdoctoral researcher at the Graduate Institute of International Development Studies here in Geneva. Dr. Kobayashi has wrote, and his article will be soon published, on a Japanese perspective on the global corona crisis, and we think that it can really complement all the presentations that we had today. So Kazu, if I can give you the floor now, please, and you have about 3 minutes for your presentation. Thank you.
Thank you, Alexandra. Can you hear me?
Yes, we can hear you.
Thank you very much for inviting me to this webinar. I'm mostly here to remind you that Japan still exists, even though nobody really noticed that we are the third biggest economic power in the world still. But so that's why I think it's interesting to present some point on this. I have seen some news headlines about so-called Asian success stories that Asian nations, including Japan, as you may know, have somehow managed to contain the corona pandemic. And I have seen these news headlines in many places, including Western newspapers. But I think in some cases this can be true, but I'm more skeptical about this Asian success narrative. In Japan, the Abe administration has been much criticized domestically for the lack of effective response policy. But even so, Japan appears to be comparatively more successful than many other Western European nations. If you just look at numbers. For instance, German population is 83 million, and 8,500 or 600 people died in Germany due to corona to date. Japanese population is 127 million. We are much bigger than Germany in terms of population, but around 850 people died in Japan due to corona. And in Japan, anti-government critics say that because of the lack of effective response from the Japanese government, as much as 850 innocent people died from corona. And this is a total disaster, they say, according to our critics. But if we compare globally Japanese case to other Western European nations like Germany, but France, Italy, for instance, Japan's failure to protect our citizens looks much smaller. And that's why I see that some newspapers in Japan or some politicians even pushing the narrative that, yes, we didn't do much, but look at Western Europe, they are, even worse than us. So that I see one of the narratives pushed by some Japanese shapers of narratives. So I have seen some newspapers talking about mysterious success of Japan, but I wouldn't really say that Japan has been particularly successful in terms of containment. But since most Western European nations suffered much more than Japan in terms of deaths, in terms of how many people died, and that's why Japan seems relatively successful. And I think that beyond Japan, an interesting feature of Asian international relations is that, in Asia, we are like a family. In normal times, when nothing happens, we are always fighting with each other. Japan is always fighting with China, South Korea, and basically we are always fighting almost. But when something big happens, when something comes up, we somehow manage to cooperate with each other. So when Fukushima nuclear reactor exploded in 2011, you may remember, China helped us very much. The Chinese communists, they didn't go on the international stage and scream the Japanese failure to contain Fukushima is threat to humanity. They didn't advance this kind of narrative. They mostly helped us. So this time, Japan established very close health and sanitary cooperation with China as early as mid-January, and South Korea did the same. And we advance regional cooperation, can be bilateral, can be trilateral, can be multilateral, whatever it works. And we also try to learn from Chinese experiences. That I think is a major thing that we are doing in Japan. So that's what I have to say about Japan. I think this can be an example of regional cooperation, for instance, even though we do not have any kind of Asian Union, we do not have acquis communautaire in Asia, unlike Europe, but we can still manage to cooperate. And I think this can be a lesson for other regions. Thank you.
Thank you very much, Kazu, for this presentation, and I apologize that it was that short, but I think you can also develop more on that now during the Q&A session and the question that can also be addressed to you. So thank you for providing this information on Japanese perspective and especially giving its success compared to the other nations. So